The thyroid gland is a small organ in our neck. It's shaped like a butterfly and is located below the Adam's apple. Even though it's small, it's very important for our body. It produces hormones that are needed for our metabolism, or how fast our body uses energy. It also controls our growth, body temperature, and even our heart rate. So when there's a problem with the thyroid, like a lump or nodule, it needs to be checked carefully. These lumps can be benign, meaning not cancerous, but there's also a chance they could be malignant or cancerous. To find out what kind of lump is in the thyroid, doctors usually recommend a test called a fine needle aspiration biopsy, or FNAB. Please don't be scared by the name, it's just a simple procedure. The doctor uses a very thin needle to take a small sample of cells from the lump in the thyroid. This is done with the guidance of an ultrasound to make sure the right area is sampled. This process is quick and not very painful. The goal of FNAB is to determine if the cells in the lump are normal, suspicious, or cancerous. The result of the FNAB is very important because it will guide your doctor on the next steps. Without FNAB, we would just be guessing what's inside the lump. Because of this test, unnecessary operations can be avoided if the lump turns out to be benign or not dangerous. And if it shows signs of cancer, we can find out sooner and start the right treatment earlier. So, FNAB is an important bridge to know the condition of our thyroid and to plan the right treatment for the patient. Think of it like looking inside a box without opening it. FNAB is the small hole that will give us an idea of what's inside. It's a safe and effective way to check thyroid nodules. It's better to know right away than to worry and be anxious about what we don't know. Remember, early detection is key to successful recovery. So if your doctor advises you to get an FNAB, it's good to follow it for your own well-being and health. Please don't hesitate to talk to your doctor. When you receive your FNAB results, you'll notice it comes with a category from 1 to 6. This is called the Bethesda system for reporting thyroid cytopathology. This is a standard way for pathologists or doctors who examine cells to report what they see. It was made simple so that doctors all over the world can understand each other and immediately know what the results mean. Each number has a corresponding meaning and estimated risk of the lump being cancerous. This is what becomes the basis for what to do next. Bethesda Category 1 is called non-diagnostic or unsatisfactory. This means that not enough cells were obtained to make a clear diagnosis. The FNAB may need to be repeated. Category 2 is benign, which means the lump is not cancerous. This is the best result. The risk of it being cancerous is very low, less than 3%. Usually, regular monitoring is enough. Category 3 is a typia of undetermined significance, or AUS, or follicular lesion of undetermined significance, or FLUS. It's a bit uncertain here, so careful study is needed. Category 4 is follicular neoplasm, or suspicious for a follicular neoplasm. Here, the cells look suspicious, and there's a 15 to 30% chance it could be cancer. Often, surgery to remove part of the thyroid is recommended for full examination. Category 5 is suspicious for malignancy. There's a high suspicion here that the lump is cancer, with a 60 to 75% risk. Surgery is almost certainly the next step here. This is a serious result that should be discussed immediately with your doctor. Lastly, Category 6 is malignant. This is the confirmation that the lump is cancer. The risk here is almost 100%, 97 to 99%. This is where the most common type of thyroid cancer, papillary thyroid carcinoma, comes in. When the result is Bethesda 6, the recommendation is surgery to remove the thyroid gland, which is called a thyroidectomy. The Bethesda system is a very clear guide that helps patients and doctors make the right decisions for health. Papillary thyroid carcinoma, or PTC, is the most common type of thyroid cancer. It falls under Bethesda Category 6. The good news is, among all types of thyroid cancer, this one has the best prognosis or chance of recovery, especially if detected and treated early. It usually grows slowly and often stays within the thyroid gland for a long time. But even if it's slow, it's still cancer that needs to be treated. It should not be ignored because it still has the ability to spread to other parts of the body. The main treatment for papillary thyroid carcinoma is surgery. This is called a thyroidectomy, where the entire thyroid gland or only a part of it is removed. Removing the thyroid gland is important to eliminate the source of the cancer. If it's not operated on, the cancer can continue to grow. As it grows, it can affect nearby structures in the neck, such as the nerves that control the voice or the airway. This can cause hoarseness, difficulty swallowing, or difficulty breathing. What's the risk if this isn't done? If the cancer is neglected, it can spread to the lymph nodes in the neck. From the lymph nodes, it can then spread to more distant parts of the body, such as the lungs or bones. This is called metastasis. When this happens, treatment becomes more complicated and difficult. That's why surgery is not just to remove the lump, it's to prevent the spread of cancer and increase the chance of complete recovery. Early surgery is the best defense against the progression of the disease. After surgery, other treatments like radioactive iodine or RAI therapy may be needed. This is to ensure that no cancer cells are left in the body. The decision of whether RAI is needed depends on the size of the tumor and whether it has spread. Your surgeon and endocrinologist will explain all of this to you. Please don't be afraid to ask questions. Understanding the process will help reduce your anxiety and give you confidence in your recovery. A common question from patients is whether all thyroid cancer immediately spreads throughout the body. The answer is no. As mentioned earlier, papillary thyroid carcinoma, which is the most common, usually grows and spreads slowly. It can remain in the thyroid gland or in the lymph nodes in the neck for many years before spreading to distant organs. Because of this, the survival rate for this type of cancer is high, especially if caught early. There are also other types of thyroid cancer, such as anaplastic thyroid cancer, which are more aggressive and spread quickly, but these are very rare. The spread or metastasis of thyroid cancer does not happen automatically. It's a process that depends on many factors, such as the type of cancer, the size of the tumor, and how long it has been in the body. Early detection through self-examination, regular checkups, and FNAB is very important to catch cancer before it has a chance to spread. So if you notice a lump in your neck, don't ignore it. Consult a doctor immediately to have it checked and to know what to do. It's important to remember that every case of thyroid cancer is unique. The information shared here is a general guide to help you understand your condition. Your age, general health, and the specific characteristics of your cancer are all taken into account when planning your treatment. Your doctor is the best person to explain your situation and answer all your questions. They will guide you every step of the way, from diagnosis to treatment and recovery. So my final reminder, always consult your doctor. Please don't self-diagnose or rely solely on information you read online. Use these as a guide to ask your doctor better questions. Talking to a specialist is the most important step you can take for your health. They can give you the right advice that is appropriate for your specific case. Let's take care of our health. God bless you all.